Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we are seeing some important points for exam. This is the video number 61 of important points section. Today's topic is cranial nerves. This is an important section. Cranial nerve. There are 12 pairs of cranial nerve in our body. We will see the names and its type, function we can see today. First one is olfactory nerve. It is a type of sensory nerve and its main function control the sense of smell. And next is second one is optic nerve and its type of sensory nerve and its main function control the sense of vision. So olfactory nerve is control the sense of smell and optic nerve is control the sense of vision. Olfactory and optic. Third one, oculomotor nerve. Oculomotor nerve is a type of motor nerve and its main function control pupillary constriction, upper eyelid elevation and most eye movement is controlled by oculomotor nerve. It is a type of motor nerve. Okay, and that is the movement of eyeball and constriction of pupil is controlled by oculomotor nerve. And fourth one is trochlear nerve. Trochlear nerve is also a type of motor nerve and its main function is control downward and inward movement of the eye. So the downward and inward movement of the eyeball is controlled by trochlear nerve. It is a type of fourth cranial nerve. And next one, fifth cranial nerve is trigeminal nerve and is a type of sensory and motor nerve, and its sensory part originate from face, lips and tongue, and motor part originate from pons, and its main function control sensation in the cornea, nasal and oral mucosa and facial skin as well as mastication. So mastication, the main important function on is mastication. Mastication is controlled by trigeminal nerve and is type of sensory and motor nerve. And next one, sixth one is abduction nerve. It's a type of motor nerve and its main function control lateral eye movement. So lateral eye movement is controlled by abduction nerve and movement of the eyeball is controlled by trochlear nerve. That is fourth cranial nerve. Abduction is sixth cranial nerve. Seventh cranial nerve is facial nerve. It is a type of sensory and motor nerve and its sensory part originate from taste buds in the tongue and motor part originate from the pons, and facial nerve function control the movement of the face and taste sensation, that is by facial nerve. It is a seventh cranial nerve, that is sense of taste and facial expressions are controlled by facial nerve. It is a type of mixed nerve. And eighth cranial nerve is vestibulocochlear nerve. It is a type of sensory nerve, that is vestibular part originate from the semicircular canal of the inner ear and cochlear part originate from the organ of corti in the inner ear. Vestibulocochlear is eighth cranial nerve and its function control the body balance and sense of hearing. So control the body balance and sense of hearing is the function of vestibulocochlear nerve. It is eighth cranial nerve and is type of sensory nerve. And next is ninth cranial nerve, that is glossopharyngeal nerve. Ninth cranial nerve. It is a type of sensory and motor. Sensory part originate from tongue, tonsils and pharynx, and motor part originate from medulla oblongata. And its function of glossopharyngeal nerve is control swallowing ability, sensation in the pharyngeal soft palate and tonsillar mucosa, and taste perception in the posterior third of the tongue. So taste perception in the posterior third of the tongue is controlled by glossopharyngeal nerve, and also salivation. Okay, this is ninth cranial nerve. And next is 10th cranial nerve is vagus nerve. It's a type of sensory and motor, and sensory part originate from various organs and motor part originate from medulla oblongata, and its function control swallowing and phonation. So Vagus nerve, its function is control swallowing and phonation, is a 10th cranial nerve that is both sensory and motor. And next cranial nerve is spinal accessory nerve. It is a type of motor nerve and it originates from the medulla oblongata, and its main function control the strength of neck and shoulder muscles. This is spinal accessory nerve, that is 11th cranial nerve. It is a type of motor nerve and is originate from the medulla oblongata. And next one and the last one, 12th cranial nerve is hypoglossal nerve. It is a type of motor nerve and this is originate from the medulla oblongata, hypoglossal nerve, medulla oblongata, and its function control tongue movement involved in the swallowing and speech. This is the function of glossopharyngeal nerve. So these are all the cranial nerves: olfactory, optic, oculomotor, trochlear, trigeminal, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Among the cranial nerve, largest cranial nerve is trigeminal nerve, that is 5th cranial nerve is the largest cranial nerve, and longest cranial nerve is vagus, that is 10th cranial nerve. Also, most extensive distribution of cranial nerve is also vagus, that is 10th cranial nerve, and smallest cranial nerve is trochlear, that is 4th cranial nerve. Largest cranial nerve trigeminal, smallest cranial nerve trochlear, and longest vagus. Next we will see the areas of the cerebral cortex. First is frontal lobe. Frontal lobe is also known as Broca's area or speech center. Broca's area for speech, and also it control moral, emotions, reasoning and judgment, concentration and abstraction. These all the functions of frontal lobe. Frontal lobe is known as Broca's area or speech center. And second is parietal lobe. Parietal lobe function interpretation of taste, pain, touch, temperature and pressure. This is the function of parietal lobe. So frontal lobe and parietal lobe. Broca's area is frontal lobe. Next is temporal lobe. Temporal lobe is also known as Wernicke's area and is the location of auditory center. So location of auditory center is temporal lobe. It is Wernicke's area. Temporal lobe is also known as Wernicke's area. And next is occipital lobe, is also known as visual area. And final one is limbic system. It controls emotional and visceral patterns of survival and learning and memory is controlled by limbic system. So cerebral cortex consists of frontal, parietal, temporal and occipital area. Frontal lobe is Broca's area and temporal lobe is Wernicke's area.